Retail Clinics by Amalia and Corey.
Retail clinics are small medical clinics that provide helpful, accessible care.
They are usually located in retail stores, grocery stores, and pharmacies.
Who do they serve? They will serve everyone, but not actually. Everyone can be seen at a retail clinic, but that does not mean that they will be treated. Also, retail clinics will not treat children under the age of 18 months.
Depending on which clinic you choose to go to, there is only certain services that they will include. Vaccinations, physicals, health screenings and testings, treatment of illness, aches, pains, minor injuries, skin conditions, monitoring/management of ongoing health conditions and medications.
What a retail clinic will not provide is treatment for life-threatening conditions like major bleeding, symptoms of a heart attack or stroke, severe shortness of breath, poisonings, or major injuries like broken bones, head injuries, or deep cuts. Retail clinics will not provide prenatal care or treatment for children under the age of 18 months, or treatment of ongoing health conditions for children under the age of 18 and patients of all ages in the state of Missouri. They will not offer biopsies, do sutures, joint injections or drainage, or chronic pain management. Retail clinics will not provide treatment of complex health conditions such as cancer, complicated mental illnesses, or Crohn's disease. They also will not treat conditions that require their providers to prescribe controlled substances or Accutane.
There is roughly 2,800 retail clinics across the United States in 2018.
Of the thousands of Walgreens pharmacy locations in the United States, only about 400 of them host healthcare clinics.
The people that work in retail clinics are physicians, physician's assistants, and nurse practitioners. A physician is a person who is licensed by the United States to practice medicine. A physician's assistant is somebody who can practice medical services or procedures, but they have to do it underneath a physician. And a nurse practitioner is a registered nurse that has furthered their education and gotten their master's and can do certain procedures without a physician's help.
Now, who even owns retail clinics? Some of them are hospital-owned, but most are shareholder-owned because they work in partnership with a retail chain whose space they occupy.
There are many benefits and limitations to retail clinics. Some benefits are they are convenient for the patient with their longer hours than your regular primary care physician's office. They also are allowed to treat minor injuries or health issues that you have. They have no hassle scheduling, or you can walk in if you prefer. They have upfront pricing that is available on their websites. They accept both insurance and cash payments, and they also have electronic records available for their patients.
Some limitations of retail clinics are, of course, the limited range of care that they may provide, the short appointment times, which does not leave a lot of time to discuss history or make a connection with a physician, the fact that the use of retail clinics causes fragmentation between you and your primary care physician. Retail clinic care is evidence-based and not continuous, and the low or non-existent copays cause patients to seek out retail health clinics and not their primary care physician. And patients at retail clinics are usually not treated by physicians, but instead treated by registered nurses or physician's assistants.
Some examples are Walgreens Healthcare Clinic, Kroger's Little Clinic, and Walmart's Care Clinic.
Other sources referenced included the Walgreens, CVS, and Rite Aid websites.
Some interesting points about retail clinics are there has never been a malpractice suit filed against any worker at a retail clinic.
CVS is now partnered with 26 health systems.
Walgreens is now partnered with 6 healthcare systems and 3 accountable care organizations.